Good afternoon, everybody. Welcome to the Grand Thornton webinar on decoding the budget of 2022. Over the next 1 hour, we will deliberate on the key announcements of the budget, more specific to the healthcare and life sciences sector, and also important to deliberate on what we expect more from the government. We have a fantastic panel of eminent leaders from the sector to share their views. Without further ado, let me introduce the panelists. I think before that, let me do my own introduction. I am Bhanu Prakash. I'm a partner in the firm. I lead the life sciences and the healthcare sector. I'm also the risk advisory partner leading the risk South region. Let me start from the left on my screen. First, Samir. Samir Agarwal is Group CEO of Manipal Health Enterprises. He is a chartered accountant. He has gained significant experience by working with multiple companies such as 3M, Wipro, Coca-Cola, and Ingersoll Rand. Next, Anish Bafna. Anish Bafna is the Managing Director and CEO of Healthia Medtech Limited, which is one of the largest independent medical devices company in India. He has significant experience in the industry. Prior to Healthia Medtech, he was at Baxter. I have next Vishal on my screen. Vishal Bali is Executive Chairman, Asia Healthcare Holdings. Asia Healthcare Holdings owns the hospital, Motherhood Hospitals and Nova IVF. He is also a Senior Advisor in TPG Growth. Next, we have Abhishek Anand. Abhishek Anand is a Country Head Finance of Lonza Group. I also have my colleagues, Biren Vyas and Karan Kakka, partners with me and from the tax practice. Welcome, panelists. I'll start with an overview of the budget. I'll probably share my 2 bits and I'll request every other panelist to share their view. I think budget 2022 is a long-term growth-oriented budget with significant outlay planned for capital expenditure. Government endeavors for inclusive development by leveraging technology. In this regard, the rollout of open platform for national digital health ecosystem, national mental health program, and BharatNet project will drive the inclusive growth as well as universal access. I think the inclusion of genome and pharma sector is a welcome move and will drive capacity expansion and encourage R&D. These, coupled with the Gati Shakti program and rationalization of custom duties for pharma and medical devices sector, will further drive the Make in India initiative. Given the significant contribution of the healthcare and life sciences sector during the pandemic, there was much more expectations from the budget. Hopefully, the government will support the sector throughout the year through various other initiatives. Thank you. I'll probably start with, I can see Anish on the first on the right side of the screen. Request Anish to share his views.
Thanks, Bhanu, and great to meet everybody on the panel. As you mentioned, for the last couple of days, the budget, of course, has been in discussion. But the way I see it, the budget is now pretty much a non-event. It's more a statement of account, and one broad framework, and then possibly tactical moves across the year. So this year clearly the key theme is to expand the economic infrastructure of the country, or through expand the economy through infrastructure boost. And I guess that's where you have things like PM Gati Shakti, Atmanirbhar Bharat, focus on ease of doing business, green economy, digital economy, which seem to be the overarching areas of focus, and the expectation of a trickle down happening to the rest of the sectors across the board. In health, as you mentioned, 2 critical programs. One is the National Telehealth Mental Health Related Program, and then the other is to focus around the digital ecosystem. And there are a few, women and children friendly programs that have been rolled out. I guess what's interesting for us is that there's increasing focus on genomics and pharma. They have been identified as sectors of growth. The other sectors, which is essentially the provider sector and the medical devices sector, really hasn't been addressed. But the recognition of mental health is very critical. It impacts 6 to 8% of the population of the country. It's a major epidemic which is unrecognized. And if you see the sort of disability, adjusted disability related numbers is pretty much, as close to cardiovascular, which clearly means that it is a pretty large problem. We've seen public health outlay, of course, increasing from 7,000 to 10,000 crores, and hopefully that will have a positive impact in the overall infrastructure play. But purely from a health perspective, as I mentioned, two sectors that pretty much were not addressed at all. I mean, there was not much soft for pharma as well. And while we talk about budgetary allocation to mental health, actually the sum allocated is quite small, right? So 597 crores has gone to 610 crores. It's not much. The only thing is that it has become a subject which people will recognize more. The Ayushman Bharat insurance scheme, the PMJ, is quite under budgeted. Just about 6,400 odd crores. Grossly underfunded. And then again, overall health as a sector is the government's contribution is low. It continues to be low. And the only thing we can expect is that possibly this year the theme is infrastructure, some trickle down to our segment. And then over the next few years, there will be more of an impact that will come to the healthcare space, where we will see an increased impetus in on health and healthcare across the country.
Thanks, Anish. I'll move to Vishal, who is next on the screen.
Yeah, thanks, Bhanu, and great to meet everybody on the panel. So, every year we basically before the budget, we all continue to hypothesize that finally the government will put health at the center of all its activities and probably give it priority status, give it all the push that is required. And it came as a surprise last year when in 2021, health was at the center of everything, right? And obviously it was the height of the pandemic. The government had to sort of present that it is worried and concerned about about healthcare as from a citizen's perspective. And so I think from putting the focus on the sector, everything right was announced the last time. Obviously, it was also, bundled under various buckets, and the allocations seem to have gone up, 157%, 160%. But obviously, it had many of the other areas of sanitation and water and everything, which was all bundled into healthcare. And then you come to 2022, and we are back to where we started in probably 2019, 2020. If you see the overall allocation increase, it's about 16% odd. You take inflation into account, we are probably less than 10% in terms of the overall increase, which is, to say the least, is not even minimalistic for where we are as far as healthcare services and healthcare is concerned. The National Health Mission, as it was created, was supposed to be the future of India's healthcare, right? Because everything was being bundled under that. The allocation for the National Health Mission is up by only about 7% odd. Again, if you sort of look at inflation, we are basically talking about plateaued out allocation. So to least say, I'm extremely disappointed with the government's approach to this sector. I'm extremely disappointed in the way that we don't seem to follow through a vision for healthcare for India. We seem to be putting statements and bundling activities together, but there is no consistent thought process. As Anish rightly said, if you take a look at Ayushman Bharat is touted to be India's health insurance scheme, right? And it was launched with so much of fanfare that now every Indian is probably going to get insured. And look at the allocation for Ayushman Bharat for a country like India, 1.3 billion people, even if we say the entire population, and yeah, it's not the entire population which will get covered by Ayushman Bharat, but 6,400 crores for India's insurance system. So something is not stacking up over here. And I think, we have to stop making statements and actually get into actual execution around what India needs from a healthcare sector perspective. I think we have to stop crowding ourselves under various terminologies and actually get down to creating healthcare infrastructure very clearly. Start thinking and rethinking around the people side, because even if we have infrastructure, education reform, yes, to some extent, number of new medical colleges have started, but paramedical education is in complete shambles. There is nothing being done about it. We talk about healthcare resourcing. There are going to be no nurses in this country, right? Because whatever was the nursing college ecosystem, everything has just got disbanded, and there is no new thinking around it. So I basically fear that we are going to continue to be in status quo with this current level of thinking behind healthcare. And 2022 to me is directionless as far as healthcare is concerned.
Thanks, Vishal. I think a lot to introspect on. I'll probably move on to Samir, who is next on my screen.
Yeah, good afternoon, everyone. And Vishal actually very clearly said what happened. Yeah, I think so. I agree to what Anish had also said. The budget and the critical part about this budget is the execution. So I think so. A lot has been said in this budget around Gati Shakti and creating of highways and 5G rollout. Benefit to the MSME sector, which is the hugely impacted sector because of COVID. But the recognition to the healthcare for driving vaccination program, in the country, which is actually leading to some of the rollout of infrastructure programs would have been great. And to Vishal's point, at least a mention about healthcare in her speech around Ayushman Bharat or creating of primary health centers, across the tier 2 and tier 3 cities would have actually had the continuity, because one of the things that our esteemed FM is getting benefit of is the continuity of the programs that is at least getting rolled out in the last 2-3 years. There is some amount of, as everyone said, non-event in terms of a budget and, activities happening throughout the year, and budget becoming more of placing like a CFO, placing the accounts to the board. But again, Vishal, it is not even 16% increase. If you look at the revised budgetary expenditure on health, the increase next year is 0.8%. It's not even close to inflation. So what has happened is the allocation towards vaccine program has reduced from 30,000 crores to 5,000 crores. And that money is actually getting allocated to maybe a Pradhan Mantri Swasthya Yojana, wherein more aims will get set up. But, setting up, and maybe we need to learn from them, because they're planning to set up 12,000 beds in less than 10,000 crores. And in private healthcare, we have not seen setting up so cheap. It is at least a 2 crore a bed kind of a facility that you need to set up, especially what the government is talking about, setting up of multi-speciality hospitals, and only 16 of them in a country of size of India. So again, it's about, what we were really expecting, Bhanu, and I'm covering that part because the rest of the part is very beautifully summarized by Anish and Vishal, and do not want to belabor the point. Is what the expectation for even from insurance premium, right? Ayushman Bharat was supposed to give insurance coverage because 60% of the spends in India are still out of pocket for a large proportion of the people. It has increased it, I think so, from less than 37% to close to 50% in terms of coverage. But Ayushman Bharat, again, less than $1 billion allocation towards Ayushman Bharat, towards the, the Modi health program. Will not do it, and this will not even push the hospitals and the medical devices industry to even invest in technology, because that was again something is to allocate. You see the amount of spends that we do, and we are a poor country in a way in terms of where the population is living, but there is still a lot of money in the system, and India could have become it is already and private sector is sort of driving it in terms of having Middle East and Africa coming to India. But again, the government could have facilitated some of this to make India global healthcare. We have everything in place. And, I totally agree to Vishal, because this wave 3 itself, we are seeing a lot of the nurses and the doctors getting sick. And there would have been a time that, you would have denied admission just because the healthcare profession is not available. So nothing, getting done on creating of nurses are running away back to the Middle East. I do not know if Vishal is seeing that. But again, the Middle East is opened up, and you'll not believe Europe has started asking for nurses from India, because they are going through a crisis in the US and Europe, and they know that the Indian nurses are the most suited. So, so again, you are seeing a lot of reverse brain drain, which will create a lot of impact on healthcare in India. Again, one of the expectation was, even the GST on insurance premium would have been removed at least, if not on our healthcare. The input tax on healthcare remains, which is a big drain because we don't get credit for it. But what is the logic of having a GST on an insurance premium, which is, for the delivery of healthcare services, which is actually output tax exempt? So some of these minimum things, if the government could have done, at least they could have, as Vishal pointed out, gone into the direction of saying that we want to make healthcare more affordable to the people out there. And we want to have healthcare more accessible to all the Indians out there. So we still have 80% of healthcare in the urban and tier 1 cities. And how do you really take it to the tier 2, tier 3 by giving incentives for setting up hospitals? So Manipal, for example, we have set up more than 1,000 beds in the last 3-4 years. We will set up 1,000 beds in the next 2-3 years. But it's done with equity and with expensive loans from the banks. And even the priority sector status has not been extended to healthcare. I really hope that it was actually done, but it was done only for working capital, only for 1 year. At least when they acknowledged healthcare to be a priority sector area, they should have at least extended it and made it a permanent priority sector status. So to be honest, Bhanu, I agree it is a little disappointing on the healthcare side. I hope that some of the capex plans that the government has, a lot gets allocated to pharma, health sciences and healthcare. And because I saw one of the finance secretaries, TV Swaminathan or somebody talk about that if there is a need to allocate more monies to healthcare, he will. But again, we all have to wait and see how the execution plans out on this budget.
Sure. Thanks, Amir. Thanks for that insight. I'll move to Abhishek. Abhishek, you're on mute.
Yeah, hi, good afternoon, everyone. Good afternoon to all the panelists. I think it's imperative most of the speaker has touched base on the most of the things, and that's really disheartening in terms of overall budget is concerned. The focus, I don't know whether it was an aftermath of the launching the PLI scheme and they didn't come up with anything substantial for the industry, especially in the form of the R&D spends and the deduction with regard to tax breaks are concerned, because that's one of the important area which ideally most of the pharmaceutical companies would like to touch base and invest more. And if you practically see from an overall investment perspective, from an R&D side, we probably lagging in the single digits, right? Whereas in the developed countries, it's on a higher two-digit in teens. So that's one of the really concerning area. They really some of the good things which I picked up, they just given a status which is in a priority sector, but are they and what they want to execute is still to be spelled out. So that's where the execution will come up, right? One of the important things, especially with regard to the priority sector, when they bring in genomics and pharma into the place, ideally the expectation would be that how government facilitate or create an infrastructure that where the academia, the research scientists and industries and the IT come on the same platform. And that's going to be in a very key thing government which has to facilitate, especially bringing the AIs or the data analytics into the research. Probably that will enable to drop the cost there. At the same time, it will also enable or facilitate to discovery of the new molecule. I'll just touch base with a backdrop of the effort when there is a need, government put in all resources, whether it is in NIV or the Bharat Biotech coming up and rolling out in a vaccination made in India, and that made a difference indeed, right? Not only from an India perspective, at a global perspective. But the thought process is like creating in a fund, allocating 20%, but how that's going to work and how is that executed is going to be pretty key in terms of overall drug discovery. And that's a key, being in a generic capital of pharma globally. It gives a volume, but realistically, the profits are so low that how do we invest in the drug discovery remains in a distant feature, right? So that's pretty important to look at, that what government is trying to do and how well they execute will be the key. At the same time, the infrastructure which they are trying to push through the PM Gati scheme, that's a key, and that's important, right? And I'll go back to April-May period of 2021, where we actually were struggling to transport the oxygen, and that was in such an important thing where we all missed out. So the ideas are good overall, but how is that going to get implemented? That's pretty important. And from a pharma sector, health sector, it will be key to look at, because such transportation of the things actually happen in a very much controlled environment. And how does that help overall to the industry or the people at large will become very key to look at.
Sure. Thanks, Abhishek. I think what I hear from all the panelists is, given the support or given the role played by the sector during the pandemic was much more expectation. However, it's not yielded that result, and hopefully we'll all hope that we'll see some more initiatives by the government through the year. I think that's the summary is what I gather. Thank you. I'll probably also take this opportunity to ask my colleague Bharat to sort of give a quick overview on, from a tax perspective, is there anything which which you would like to share?
Sure, Bhanu. First of all, good afternoon to everybody, and thanks, Bhanu. Glad to have such such energetic and vibrant panel. It's really glad to see all of you. First of all, while some of the points already touched upon, I would like to highlight one point, a couple of points which will be particularly IDT perspective, whereas first one will be generic, where in case of increasing budget outlay for national health mission, like it has been increased from 34,900 plus crore to 37,800 crore. See, while situation of almost last 2 years has been made nation aware of the importance and need of the enhancement in infrastructure and accessibility of healthcare services, this will help to achieve more universal access to equitable and affordable healthcare services. While they could have done more, considering now the extended period of 25 years, vision of 25 years, which is introduced as a Amrit Kal in front of us. While they could have done more, probably this around 4.9, around 4.5 to 5% seems to be a little. That's one point which I thought let me highlight. Such increase in budget, will certainly help to move interestingly, but it will be important to see that how it's allocated, as Abhishek had rightly mentioned, how it is allocated and used in varied areas for the sector, which will be very important to see whether it's sufficient or not. That time will highlight. We'll move to a couple of IDT perspective announcements, which seems to be more with an intention to move towards the Make in India concept. First and foremost is custom duty exemption, which would be phased out on identified drugs and medicines and diagnostic kits as well. Now this will be gradually phased out, more with an intention to provide a level playing field for the domestic capacity, and also with an aim of meeting the PLI schemes which are aimed to address particular focus of increasing the manufacturing growth in India for identified products. This would certainly help pharma sector for innovation as well. Though the medicine and medicines are manufactured in India, such products are manufactured in India today, but possibly it will help to be more focused on approach of production growth. That's something which government is trying to aim, but let's see over a period of time how it goes. And second, importantly, the reduction of custom duty. Now, while first one was the removal of exemption for identified products, now this one is the reduction of custom duty on a few imports, like medical and surgical equipments, again identified quite a little. It's not a comprehensive list as such, but it will certainly boost the innovation. They are trying to boost the innovation with such introduction, and enhance that technology is also something try to meet the level global market. Probably maybe basis the import, they may implement something, they may do something in India which helps to meet the global need, which helps to meet the global standard, something which attempt has been made. In the coming years, such innovation could help to achieve Make in India. But again, considering the amount which is allocated, seems it might take little long. Couple of few announcement, like inclusion of pharma, particularly in sunrise sector, will also benefit to build a strong domestic capacities. It will help domestic manufacturer can look at options available and implement to reduce the dependency on other countries, which is, I mean, nothing new that I'm highlighting. And even R&D will be encouraged. But again, how much percentage, because blending finance of 20% to be managed by the private fund managers will help for more effectiveness. These are, couple of points which, they've tried to introduce, which might support in execution. But, again, there's a question mark, how effective it will be. That's something which is comparatively new. And lastly, 2 points which they could have done, they could have highlighted some points or some clarification with regard to is zero dated GST structure on healthcare services, which is, one of the expectation of the sector, and probably they could have, given some indication about it. Restoration of, weighted deduction under income tax for innovation and R&D, which was already removed earlier, probably, which would have certainly helped, which would have helped the sector. And inclusion of pharma again in roadmap, which is recently introduced, probably, something which they could have focused. Nothing more than this. Thanks. With this, over to you, Karan.
Sure. Good afternoon. I don't think so anything much is left for me to say because everybody's covered most of it. But nevertheless, let me start on a little positive side to look at it. While we know a lot has to be done and there were a lot expected, which is not yet being achieved or not being announced. So I'll just touch upon, only 3 areas. One of them already Sameer has touched upon on the out-of-pocket expenses on the healthcare side. So I'll be taking the cue from that and touching on the tax angle, from there. So the first one I'll want to touch on the positive side is on the proposal, under income tax, that any expenditure which is given by the employer to its employees for COVID-19 treatment or the family members is allowed to be removed from the perquisite value as part of taxable salary. So which means, that will be a relief for the employee. It will not be taxed, any, help which is extended by the employers. And likewise, it will also not be counterproductive for the employees or employers himself also, because that can be claimed as a business expense. So that is one of the, notable, I would say, welcome move from the income tax point of view. And also there is a proposal to exempt ex gratia amount given to any person unfortunately got deceased in this COVID-19 due to COVID-19. Any ex gratia which is received by that particular member or the family is also exempt free from income tax. So I would say, government has been a little bit considerate, and sympathy, has been shown here on this account. So the next one is on, what Sameer also touched is on out-of-pocket expenditure, which is quite high on, healthcare expenditure in India. So the expectation was definitely to increase the threshold limit, at least on the, Chapter 6A of Income Tax Act, to increase the limit of claiming the deduction. Which unfortunately, did not happen. So there has been a lot of representation that, because the expenditure has gone up, because the pandemic is there, and there are other health issues otherwise also. So why don't you want to increase and bring more people into that, kind of a health security, which is a social security for any citizen of India. That is a bare minimum a government can do. So to, give that income tax benefit indirectly, which will help all the citizens of India. So that has been clearly missed out. The other thing, which is, I would say, not related to budget, but yes, because in the budget we have heard about manufacturing, PLI schemes, capital goods, expenditures, etc. So this being a service industry, healthcare specifically, there was under the foreign trade policy, they used to get, services export of India, incentive, if we were exporting any services. So which not only encourages, medical tourism, India becoming a medical tourism hub, also encourages the, kind of medical services what we provide to the world. So, while I understand this is not something part of, union budget, but something in to encourage the service sector also could have been, announced by the finance minister, while, the legal course could have been, done under the foreign trade policies or any other incentive policies. So that is what, what I believe I see of this budget, while, all of you've covered most of it. So Bhanu, back to you quickly.
Thank you. Thanks for that. I think very different insights from all of us.
So Bhanu, just before you summarize, I just wanted to tell Karan. So Karan, the points are valid on the benefit given, but those are all one-time benefits. So Karan, why only then give benefit to COVID? Rest diseases, aren't they important? I'm saying a lot more people are still dying in this country of influenza and diarrhea than COVID. So COVID is, again, it becomes, the sector becomes a lot more from populist side, but COVID was the talked about word, and hence the benefits were given on COVID. But the whole discussion that we were doing is, since the finance minister presented this budget for India at 100 and the next 25 years, a roadmap on healthcare would have been that's what Vishal also mentioned. The roadmap on healthcare should have been, laid down and continued on, which was discussed in the last budget, to take the expenditure to 2.5% of GDP, and we are still at 1%. So even Pakistan is more than us. That was the surprising part.
Yeah.
So having spends around there does not argue very well. So Karan, that is what we were discussing. Though we agree with some of the proposals you mentioned, but seem to be very one time.
Absolutely, Samir. I totally am in agreement with what you're saying and what you echo. I also echo the same thing. But yeah, I was just trying to bring out something, differently what has been said by you and the eminent speakers. That's what.
He's trying very hard to be positive, Samir. So that's
yeah, because I've really heard that government has not done this, the budget has not done that. So let me see. Okay, what has been done? Let's try to find out that.
Thank you. Thanks for all the insight. I think it's wonderful to get some perspective, both positive and things which we expected more, which has not yet come in, and hopefully that we'll see something. I'll probably move to some specific questions which I had, and I'll probably have some of them for each of you to get some thoughts. I think let me start with on the first initiative which was rolled out, the rollout of the open platform for the national digital ecosystem. It's a welcome move. I think even from when we had done a pre-budget survey, we had noted that at least 56% of the people had highlighted that it's a good move, but there's more needs to be done in ensuring that the data privacy and the patient privacy, data security is protected so that the private sector can participate. Now, given that it has got a significance, I probably thought, and maybe this is more for Vishal, as an investor, do you see startups and private sector players have a role to play in this initiative to further enhance the universal access? What can be done by the private sector?
No, so Bhanu, this is definitely a good move, given that digital is going to play such a big role in the way that healthcare services, healthcare products, the entire healthcare ecosystem has to move on the back of more digitization. Because we have all lived in an era, and particularly in this sector, where digitization meant more at the back end, which was you put an SAP system, you put an Oracle system, and that's really what digital meant, right? In terms of that, you basically use technology in very little doses, which was more in terms of creating more efficiency at the back end. I think the way that the wave also, and thanks to COVID, I think digital has come at the forefront of it all. It started with the entire thing of how do you really create access, and the fact that India is going to have more than 900 million people with internet access. I think that's the highway on which a lot can be put, and rightly so. They are, now that the network is there, and obviously I think a lot more still needs to be done as far as the tier 2, tier 3, the last mile connectivity in many of the smaller cities is still not as sharp, right? So while it has reached to a certain extent, but we still have some miles to go. But effectively, I think the future of healthcare delivery has got transformed to a very large extent. And that's the reason why I was also saying when I started that, when we react the right way. I mean, for many years, the laws around telemedicine and the regulations around telemedicine were all stuck in the backwater somewhere, right? Suddenly comes COVID and everything gets, accelerated. And lo and behold, you have a new regulation which allows you to do everything. And see what? On the back of a lot of that, you see the number of new startups that have now emerged in the digital health space. Areas around telemedicine, areas around, e-pharmacy. For a very long period of time, e-pharmacy was clouded with, rules not very clear, shrouded, everybody. And in fact, for all investors, it was a very hard time for some time because we never really knew the clarity of what's on the regulatory side over here. Last year, the moment the regulatory side opened up, you see the way that some of the companies have got accelerated. So I basically believe this is going to be a great era for digital health companies. This is going to be a great era for startups, which are basically trying to use the digital ecosystem. And, and of course, with this entire move on data in terms of just digitizing healthcare practices per se, because it is the entire ecosystem. It's going to create a lot more transparency and most effectively, I think it is going to create that last mile healthcare access, which today is going to be very difficult, given that we are a hugely capex constrained sector. And that's where a lot more needs to get done, because if you want to put 1 million beds in this country, you need a capex of a very, very different magnitude. Now, if access has to come, then it has to only come through other means, and therefore digital is that mean. So I think that's a right way. Again, Bhanu, what I would like to re-emphasize again is that we need to move into more concrete execution steps. Last year, the finance minister talked about, One Health and that National Institute of One Health. I was just going through some, what have they done on that? And all that has got identified over the last full year is a piece of land where the National Institute of One Health is going to come up. So between an announcement and an execution lies the reality, right? That are we going to just get shrouded by multiple slogans, or are we really going to see last mile execution? And I think many of these initiatives matter a lot for India's future in healthcare. So while the thinking is good, the thought process, the vision is good, but ultimately it's all going to be on the execution side. And if again, digital gets lost in 2023 and something else comes up, then, we've sort of then again created a system which is only for, that particular year, and some announcement which fills up, the eyeballs for that year.
Sure. Thanks. I think what I'm hearing is the consistency and execution. I think there are two things which I pick up from this. Definitely. Thank you. Thanks, Vishal. I guess I'll move to the next one, and I'll probably request Sami to sort of respond on this. Is the outlay under Pradhan Mantri Swasthya Suraksha Yojana has increased by 35% to reach 10,000 crores. It's 2,500 crore plus increase is what we see, primarily aimed with minimizing the regional imbalance and of course augment the medical education. When we had done a pre-budget survey, we noted that around 58% of the participants believed that the private sector participation, or basically PPP model, can enable private sector to participate in this. Just wanted to get your thoughts on, and you also touched upon the rural infrastructure and how government is going to see implemented at a cheaper price. Just thought I'll get your thoughts on, is there a way for private sector to participate? If yes, what do you expect from the government for private sector to participate in this?
Thanks, Bhanu, for that question. And the Pradhan Mantri Swasthya Yojana was actually a 2003 kind of a program, and good. It is important that it getting increased allocation. That is for setting up aims, and along with aims will come medical education as well as OPDs and 750 bedded hospitals around 16 places in the country. So it's a very good move. Again, it depends upon how they execute. If you go through the site, they seem to have executed a lot on the upgradation of facilities. Setting up the facilities is a whole new ball game, because typically some of the big hospitals that you plan to set up may even take you 2 to 3 years. So on a minimum. So it depends upon how fast the government really proceeds on that. Yeah, the regional imbalances for everyone to see, right? Where 60 to 70% of the healthcare has got done in the urban towns, and most of the doctors are there. So the telehealth was an important announcement, to be honest. So if with COVID came in, the regulation that Vishal talked about, that created some amount of access to people in the rural, because everyone in India has a mobile phone, to connect to at least getting the OPD consult. But again, it's not about only the OPD consult, and the telehealth will do that. But what about the inpatient or the surgical interventions that has to happen? For that, the rural has to still come to the bigger cities. And some of the benefits that could have, and hopefully, healthcare should be included in the PLI scheme. And I do not know, it is pharma, but healthcare as well. I think so. If the PLI scheme or certain funds are made available to the private healthcare of setting up hospitals in this tier 2, tier 3, and that is one benefit, Banu, you can get by, for example, Manipal, for example, we have 1/3 capacity in tier 2 and 1/3 capacity in tier 3. But if you look at some of the other larger chains, a lot of their capacities are there in the urban only, right? They are in NCRs, or they are in Bombays or Delhis of the world. To give that benefit, either the government can participate, like how China created capacity by giving land sort of free of cost, and then asking the hospitals to build up facility, and maybe having something towards the EWS. Of a similar thing happened in Delhi, where the government does that. But again, it can become a national level program for asking the private healthcare to set up capacity in the tier 2, tier 3 towns, but by making land available, or by incentivizing the profits made there, for example, because that also comes after 3-4 years. It does not come in year 1. So some of the benefits around income tax, which Karan talked about on the individual side, one can also look at some of these benefits on corporate side for the private sector to sort of participate, because at the end of the day, the private healthcare is raising money, and Vishal definitely is privy to that. But we raise money, shareholders also expect value creation, right? So till the time there is in a public-private partnership, wherein it can really be a partnership, and we have done something in the health map side of setting up diagnostic centers within the government hospitals. So that is, it's quite interesting, because it has happened and it is working very well, wherein we put up the instruments, but they provide the facilities, and you can do an X percentage of business of the government, but you can do an X percentage of the business outside in cash, which helps you to make money. So similarly, they can start off by doing some PPPs, wherein they can give out a cardio unit or maybe an onco unit to a private healthcare, and then ensure that the financials, and it has to make money at the end of the day. Private healthcare money will not come free. And already some of the inflationary trend may push up the interest rates in the short term, right? So some of this benefit maybe even provide cheap capital to private healthcare for setting up some of this would be important, Bhanu. What will this do is, once the capacity gets created, and we have seen that India is a large country, we have 130 crore population in the country. A lot of the population comes to the cities from northeast, from and I see the esteemed Prime Minister pushing a lot of northeast development, right? And he has done a lot in the northeast side, but there is a lot more on the healthcare that needs to get developed in that part of the world, because a lot of them still come to Delhi and Bangalore for treatment. And if you can provide something on the M&A side, right, wherein the consolidation of healthcare can happen, capital can come into the country. We still have some issues on the FEMA side on how a foreign listed, foreign owned company can sort of invest, of how do they raise money domestically, because domestic money is cheaper. So some of those things can be done, which can actually change the game on creating capacity, because we all need to know that we are still 4.8 beds per 10,000 people in India. And even the WHO standard is 20, right? And more, I'm not even talking about the developed countries, because we are not there as a country, but some of the even countries like China have 20 to 30 beds per 10,000. So we are very, very way off in terms of the beds required for the population. And like how Pradhan Mantri Swasthya Yojana or whatever is created, they need to make a PE fund through the NIF or whatever mechanism, wherein some of the investments can be made for setting up capacities in tier 2, tier 3 towns. I do not know if I've answered your question, Bhanu, but that's.
Yeah, thank you. I think you have a lot. I'm sure there is a lot for the government to do in this. I think you're covering broader area of just not looking at the short-term plan, but how private sector can participate, partner with the government in the long run on this. I think those are good inputs. Thank you. Thanks, Amir. I'll probably just come to Anish once. I just want to talk to him on the medical devices. Anish, you have been in the international market for a really long time, and I've seen the international market. So, just want to get some perspective on how is the Indian medical devices market different than the international market, and if you have to scale up, what do you think are the support needed from the government?
Yeah. So, Bhanu, Vishal and Samir brought out two very important points around both capability and capacity, right? And we are under by 1 million doctors, 1 million nurses, 1 million beds. So there's a fairly long way to travel. Now, the one thing is that, you cannot create an healthcare ecosystem in a year. So you can't say this is the year of healthcare. We will create $100,000. That's not 100,000 doctors. That's not going to happen. It's a slow grind, and it needs continuous efforts over years for it to develop, which is what I've seen in the international markets. The focus around health is extremely high, right? So even if you take a small country like Thailand, they have the 30 baht scheme, where pretty much the entire population of the country is covered on health, right? Or, on the other extreme end, you have Singapore, where they say, okay, health is your problem. We will give you 2 insurance schemes where you will have to subscribe to, but we'll tax you only at 10-12% on your income tax. And we expect that you will save a part of that, or, take insurance schemes and, manage your health better, right? I guess we still don't know where we stand. So, we have we've tried to bring in something like the PMJ, but, funded it grossly. We have issues with private hospitals, profitability, while they are the ones that are really going and creating that infrastructure. So if I look at that, the ecosystem required for the medical device industry to prosper is really not there. It's a $400 billion industry. India is $7 billion. So you have 20% of the population of the world consuming about 2% of medical devices. And compare it with China, which is about 13 to 14 times larger than us right now. China was in a similar predicament like us about 25 years back. But over a period of time, because of captive consumption, they have a large number of companies that have really grown, not only in China, but are dominant or getting into dominant positions globally also. Right? If you go to exhibitions like Medica, 45% of these stalls are occupied by the Chinese manufacturers, and none of these products are being manufactured out here in India. What we have going for us is, you've got a large population. If we invest in capacity and capability, medical device, what does it require for a country to form a medical device, a strong medical device industry? You need metallurgical skills, you need engineering skills, you need software, you need plastics. We have all that in abundance. We are doing a brilliant job in the auto component industry, and there is no way or no reason why we should not be able to replicate the same in the medical device industry. But the first and the foremost is you need captive consumption. We've got 800 odd companies in this country in the medical device field. Most of them, almost 90% of them are in the 20 to 25 crore kind of a mark, right? Now, how do you expect a company which is 20, 25 crore to invest, multiple crores in R&D, create specialized products, create world-class facilities? It's a dichotomy. It is actually shameful that a company like India has a high dependence on imports of medical device, almost 80 to 85%. None of the large multinationals have set up manufacturing units in India. So, either you have these small 800 companies that are, providing products across the country, or, you depend on imports. And of course, the government has done a little bit around custom duty enhancement for some of the products, but I guess a lot more to be done. But, if we do the right things in terms of both, in terms of supporting the local companies, the talent base exists. the necessary infrastructure exists. It's all about us tapping on it and building it up, right? So I mean, what needs to be done? We need to create additional capacities, right? We need to give preferential market access to local companies. Of course, quality is a zero compromise area. You need to have a certain set of quality for the product to be accepted. But you have, varied countries, like for example, in Turkey, you get a 15% advantage over a imported product if you're manufacturing the product locally in local tenders. Something like Iran and Bangladesh, if you have 66% capacity available in the country, then imports are banned. So different countries, depending upon their status and situation, handle it differently. But there has to be some preferential market access. And I'm not saying it's not happening at all. It's slowly coming in. But again, L1, L2 is a very dangerous game, right? Somewhere you do tend to compromise on quality. Then, PVLI schemes for consumables, it's very important. Consumables are a very important part of not only the ecosystem for the provider and the patient, but also can be a great tool of exports for this country. There's multiple, you've got great labor arbitrage, you've got great engineering arbitrage. We can really play on that and build it up. GST on health is 18%. I mean, we are not a consumer company, it's not, we are not a luxury company, so industry. So the GST has to be brought down where it makes much more economic sense for everybody to also invest more. We have to focus on the exports out of India. R&D, how much does the country spend on R&D, right? And we're all aware that as a country, we spend only 1% on R&D. Something like in Israel and Korea spends 4%. So, all these things are very important. And, the one thing sort of that is a little disappointing is, I've lived in a lot of countries and I've not had a lot of interaction post their annual sort of exercise in terms of taking inputs from the industry. There's a lot of inputs that, are taken from the industry at least 2 months before the budget. The question is, do I really want to go and spend so much time again giving inputs when it really doesn't matter?
Understood. Thank you. I think there are definitely a lot of inputs which can be considered. Thanks, Harish. I think you really talked about capacity expansion and giving fiscal incentives, promoting exports, some of these aspects which should, and of course, I think the biggest aspect is encourage the consumption, the sector which will consume the medical devices, build better structure, that we give them more support so that automatically the medical devices sector will grow. I'm sure Samir and Vishal will love your argument on this front. Coming to Abhishek, thanks for that insight, Anish. Coming to Abhishek, the government has moved pharma sector into sunrise sector initiative, but it just stops there. There's not much of details. So I probably want to get some thoughts on what is that the pharma sector expects from the as initiatives or support of being in sunrise sector. What do you think they should be looking at and doing to support pharma sector?
See, Bhanu, that's a very interesting question, and the thought process from the government side seems to be very noble, right? And I'll just give you a little backdrop, especially from the pharmaceutical side. Where does the real interest lies in is, are we capable in terms of having any molecule discovery? Can we do something in genomics or biologics, which is the sunrise sector coming up within pharma industry? And practically, we do have knowledge, we do have capable people, but we don't have capital or we don't have money to invest realistically over there. So we see there are a lot of academias which is there. There are a lot of government-funded institutes are there, right? There are a lot of scientists who do carry a lot of work around there. But then what's happening? Are they just work done for getting it printed in a kind of a magazine, or are they really coming and putting some impetus to the social health or for the people? What's there in for the society? So that's the broader picture lies in, and I welcome the thought process where they are trying to create a fund and channelize these fund or resources in terms of quality research, which is capable to bring something to the society, and that's a positive initiative. Now, all said and done, one is the noble thought process. Second is the perfect execution. Now, that's a separate thing, whether they execute well or not. The good part is that they say that they will contribute 20% fund and let the private player to handle it. Now, if they do it, and if they do it well, it's really good. But at the same time, the another aspect which I think government should really bring that into black and white is that when they're thinking about the sunrise sector, they actually have to create a platform. And the next buzzword I will say, especially in the pharma, especially in the research side, is the bio IT. That's a quite important thing, because that's going to bring the overall cost of research down. If there is a data analytics, there is an artificial intelligence, and we know that TCS of the world are doing a lot of fundamentally good things, especially in there. So if they can actually collaborate, or if they can create an environment where these academias collaborate with these IT companies or these IT impetus and do something really good, and at the same time they bring in the pharmaceutical companies to that platform, which can actually look at it and say that, yeah, this is something which is scalable commercially. That's very important. Today the research is being done, but if it's not commercialized, it's not leading anywhere. So this entire concept of sunrise industry is really good, and especially at the backdrop of COVID, what we had seen. And I really say that probably beyond Covaxin, I haven't seen, or I don't recall that there has been any molecular discovery from our side. Right? So it is very important to get these three components. What I feel is really good to bring an impetus on the drug discovery side to really go beyond the generic medicines what we are trying to do right now.
Sure. Thanks, Abhishek. I think your emphasis is on how do we support development, and probably that brings me to one interesting question. Maybe I'll ask both Abhishek and Anish for you guys to pick your thoughts on this. Today, I think the R&D spend is 1%. Or rather, I think it's, as per the economic survey, it's 0.86%, of which 37% is contributed by the private sector, and balance 68 plus, around that number is contributed by the government. So I was just wondering, what should government do to facilitate, increase this percentage? I think one is the fiscal incentives is talked about. We're all expecting 35 to AB will get weighted reduction. Unfortunately, it did not come. So I'm just thinking, what can be done beyond that?
And if Anish permit, let me come to it before, because I think, see, there is a certain impetus required, and that's very important in terms of government to recognize that these kind of investments are required, and that's where the certain incentives have to come in, whether it is in form of subsidy or whether it is in form of higher tax breaks as far as companies to invest. That's in a long drawn process. The spend in R&D is in a long drawn process. It's not that you do it today and you get a return immediately. That's an effort of 7, 8, 9 years or even more, and that too you don't have a guarantee on the success of it. Right? That's an area which make companies skeptical too, to whether they do something over there or not. So it's very important for government to think in that direction, that if they are looking towards giving a status of sunrise industry, what they really need to do in terms of creating an environment over there, that government alone, they are very clear that they alone cannot fund it, right? At the same time, they want a private player to participate in it. Now, private player participation has to be incentivized, and that's the one of the area they actually have to look at it. The interesting point which Anish and Samir and rather most of us had brought up is that incentivizing is so important, that today we all are trying that we don't have enough population to support their own health or well-being. At the same time, we want to promote the insurance for the common people. But at the same time, as in a government, I'm not taking an initiative to reduce those premium, those GST on those premium from 18% to 5% or to nil. But that's a kind of an apathy we are living in it, right? Because we want to ask people to take care of themselves because we are in a hugely populated country. But at the same time, we are not giving that incentive that the burden from the government hospitals is shifting to some other hospital or healthcare, and a person is spending out of his own pocket, but they are still getting taxed for those services. That's an apathy we are living in it. So that's where the directions has to be brought in and a concerted effort, especially that looks like something is getting messed up.
Thank you. Yeah. Anish, tied in?
I guess, Bhanu, you know, I mean, the fact of the matter is that there is an entrepreneurial culture in this country, which is why we're seeing so many startups. You've got about 150 odd startups just in the healthcare space in Bangalore alone, which is great. But I guess by a little bit of impetus, you know, all this talent pool, all the sort of ingredients can be brought together and we can really capitalize on that. One is, you know, we need a strong R&D infra, right? Now, most startups or most companies don't have the ability to invest. So if the government can help in establishing centers that can be used, you know, leased, you know, for R&D purposes, that could be a great sort of infrastructure support for companies that are trying to innovate and bring new products or new services to the fore. The other is, you know, for R&D, we have to continuously keep on importing, you know, machines, right? Equipment, right? I mean, if even that was taken off the import duty list, then that would add a lot of impetus because you wouldn't be spending an expense on an expense. You did talk about, you know, the weighted expenditure under section 35 to AB. I think that is, of course, very important because it sort of creates the environment. And the third thing is also the implementation of IP laws, right? I create something and somebody else comes up with a similar product within 6 months at half the price. And, you know, it clearly defeats the purpose of investing into R&D. And then finally, you know, if you have products that sort of the country brings out, you know, how do you take them internationally, right? I mean, considering that we are smaller players internationally also, there is support that is required in terms of product registrations, in terms of commercialization, etc., of these products, and, you know, make them big in the international market. So I guess, you know, if the ecosystem comes about, we can achieve quite a lot. And, you know, I mean, of course, this government is also playing catch up of, you know, hundreds of years of things not having done in that side. But now we need to accelerate. We can't wait another few years before we start the process.
Thanks, Anish. Thanks, Anish. Wonderful insights. I think with such an engaging panel, we can go on forever. My colleague is reminding me, look, you're already 3:01. So I'll probably have to, you know, close the panel discussion. Thank you, panelists. It was such a wonderful conversation, having great insight. I definitely have key takeaways. I'm sure the audience as well. Thank you, audience.